Well, let's talk about all that right now with Matt Hancock, the Health Secretary, who joins us. Good morning to you.
Good morning.
Good morning. Why is Leicester seeing a spike in coronavirus cases?
Well, we don't exactly know, but we know that it's happening. And my heart goes out to the people of Leicester. Whilst the rest of the country is able to lift some of the lockdown measures on Saturday, unfortunately, we just have got to get this under control in the city of Leicester, where the number of cases is much, much higher as a proportion of the population than anywhere else, and so what matters most is that we take the action that's necessary, and of course we're working to get to the bottom of it.
Okay, now look, we knew that local lockdowns was going to happen. We knew that us coming out as a nation from lockdown, that this was going to be how we would tackle local outbreaks. And yet we spoke to the mayor of Leicester, Sir Peter Soulsby, talking to him again this morning. But yesterday he said, look, he hadn't gotten information from your department until sort of early hours of yesterday morning, even when this was already being mooted as a possible need for a lockdown, that it even suggested that there was a spike, and yet it looks like the Department for Health was getting word of a spike 11 days ago. Why has it taken so long to share that information with local elected officials on the ground?
Well, yes, we shared the data last week with his public health officials, and I'm very glad that Sir Peter has now come round to the view that we need to take this action and is supporting the action on the ground. Of course, we've been trying to work hard with the council over the last 10 days. And if you think about it, we've been taking local action in lots of different areas. In Keighley, we worked with the local council, who are absolutely brilliant. And we tackled an outbreak that was there. There was a factory that had to close, and it didn't lead to community transmission. Unfortunately, in Leicester, we've taken over the last couple of weeks exactly that sort of action, put in the extra mobile testing units, and worked very hard with the public health officials at the council, who are excellent. It was clear that wasn't working well enough, and so we had to take this further action that only a national government can take.
So everyone in officialdom has been excellent, and yet we're seeing this spike. Does that tell us that the local people in Leicester aren't social distancing and aren't doing their bit and haven't been obeying the law? Because if they were socially distancing, there wouldn't be a spread in the community, would there? So should we stop tiptoeing around and ask the question, is this because people have not been obeying the lockdown rules properly and that's why it's spreading? Or is there another reason?
Well, it's clear that people do need to follow the social distancing
rules. So they
rules.
Haven't been?
Well, we've seen examples of that, and we've got to make sure that people do. And unfortunately, if we do see local outbreaks, then we are going to have to take this sort of action to get them under control.
Okay, but again, if we are seeing local outbreaks, it's very important that we identify the cause of them, the reason for them, so that other people can learn lessons and other areas can learn the lesson. If this is down to a meat packing factory, like it has been in another area, then okay, we know to tackle that issue. If this is a large section of the population of Leicester simply ignoring social distancing rules, carrying on as normal, not obeying the law, then that tells us that people need to learn lessons from that.
Well, that's right. And hence we're putting in place this further action and the communications that are necessary to get those messages through, alongside the working with the factories in Leicester where we've seen outbreaks, to make sure that people do isolate if they've been in contact with a positive case. So all of that has been going on, but it was just clear that we needed to take further action. Okay,
we've been told repeatedly that the schools is not where the virus is being passed on. There's no evidence of children passing it on to adults, and children are very unlikely to get very ill. Why are the schools in Leicester being closed then?
I'm afraid you haven't been hearing that, certainly not from me or from any of the public health experts that advise me. The good news is that children appear to be very, very low risk from this disease.
So why are you closing the schools?
Because children still risk transmitting the disease. So they themselves are safe, but they can still transmit the disease. It's a really important distinction.
I believe an awful lot of the evidence that's been coming out from other countries is that actually there's very low risk of children passing on the infection to adults.
I'm afraid that isn't the clinical advice and the summary, of all the clinical advice. I know there have been some studies that have shown that, but unfortunately,
so why are you telling millions of parents that it's safe for their kids to go back to school then?
It is absolutely safe for the kids, and where there is very little disease in the community, then it's also safe for the community. Okay. But where, as in Leicester, there's a higher level of disease in the community and the virus is going up as opposed to coming down, then we do have to take action, just as we had to in the peak across the whole country in terms of closing schools.
Let's just talk about how it's going to work in Leicester, though, in terms of where is the boundary? Have you decided at which point, on one side of the road, a school has to be closed and a shop has to be closed. On the other side of the road, it doesn't. Are you going to have roadblocks so people are going to be allowed to travel in and out of Leicester? How will it work?
Yeah, so this will cover the whole conurbation of Leicester, because the formal city of Leicester is actually only part of the conurbation. There's a whole load of areas that are technically in the county of Leicestershire, but still are in the Leicester conurbation. That's going to be included, and the county council this morning is going to publish the exact map of where this covers. But again, that is a matter for a local decision. On the point about travel, really important point. We're recommending against all but essential travel in, out, and within Leicester. But clearly, again, people have followed these sorts of recommendations when that's been the government policy. We can take further action if we need to and put in place more stringent legal controls on that. But I hope that we don't have to, because I hope the people of Leicester will follow the social distancing as necessary.
We're talking a lot about Leicester, that local lockdown this morning. Very first area of the country, very first city to experience a local lockdown since we've come out of the full-scale lockdown. Indeed, just days before we come out into sort of some semblance of normal life, with the pubs and restaurants and the hairdressers reopening on Saturday, but not for Leicester. Sir Peter Soulsby joins us. He's the Labour-elected mayor of the city of Leicester, and he joined us yesterday, in which he was saying that there was really no need for a local lockdown. But today he joins us once again. Good morning to you, Peter.
Good morning, Julia.
Good morning. Have you changed your mind after seeing the local data? Do you think we should go ahead?
It was, nearly 2 weeks ago when the Secretary of State said he believed there was an outbreak in Leicester. And it was only yesterday that they provided us with any sort of data to justify that.
Well, you told me that yesterday, but Matt Hancock just told me about 5 minutes ago that they over a week ago, they provided the data to your public health officials.
No, they downloaded the first bunch of data on Thursday last. But it was only yesterday they put it all together and said that they believed that it did amount to a need to intervene. And that's best part of 2 weeks from saying they believed there to be an outbreak here. And that's been a very frustrating 2 weeks for all of us, because, of course, we have been, like everybody else, continuing to prepare for the reopening, the Liberation Day on Saturday.
Well, indeed.
It's very frustrating now that having spent those 2 weeks preparing for liberation, we've got to go back into lockdown.
But do you think that was the right decision?
Oh yes, I've no doubt. And if there is an outbreak in Leicester, we need to be on top of it. It may be a bit late coming to it, but it's better that we do it, and we do it effectively and comprehensively in the way that is now being planned and prepared for, than that we do it half-heartedly. And
do you think that the people of Leicester are prepared for this and will go along with it? I mean, we're being told that even the new powers, still an element of lockdown from Saturday onwards. These are no longer going to be laws; they're just going to be advice. But Matt Hancock has said that he will actually pass, there'll be legislation to ensure this lockdown does happen in Leicester. But are the people of Leicester generally saying fair enough if that's what's necessary to protect lives, or is there going to be quite a lot of anger?
I think there'll be quite a lot of frustration, because I think, like me, people will be saying, well, if this is necessary, why didn't you tell us earlier? And why didn't we get onto it earlier when you first suspected that there was an issue here? That would have been the time to intervene. But we are where we are. And I think that overwhelmingly Leicester people will recognise that taking the very firm measures that are now being taken is in our best interest long term. because obviously the firmer we are now, the sooner we'll get out of it.
Indeed. And if you manage to get to the bottom of why this has happened in Leicester rather than anywhere else, there seem to be a variety of different answers. Matt Hancock, the Health Secretary, didn't seem to know any or was willing to say any. Some talking about lots of people working in local meat packing factories where the conditions are rife with cold, wet conditions. A lot of people talking about deprivation, language barriers preventing, I don't know why language barriers prevent people from exercising social distancing, but there's a particular concern that the two areas of Leicester that most seem to be seeing these spikes are Evington and Spinney Hill. Both have mainly Asian local communities, and there seems to be some concern. Again, I think people are tiptoeing around this, but it's a question I'm asking. I don't know the answer. I'm asking you the question. Is it the case that certain communities are not obeying the lockdown? Or is it that it's difficult for certain communities if they live in, for instance, 3-generation households in small homes, it's difficult for them to obey social distancing? Are any of those factors in play?
There is no evidence that it's particular communities or particular issues. Yep. It looks as if it's quite a variety of different factors that are perhaps combining to cause this spike in the figures in Leicester. But this is one of the reasons that we've been asking for the figures from the government, because what we need is not just the overall numbers for the city, but we need to know by community, by neighbourhood, by street level where the positive cases are occurring, and then we at a local level can intervene and give advice. As I say, it's been really incredibly frustrating. We got that first load of figures from them that gave us a bit of the street level data last Thursday. Well, we're a long time into this virus and a long time into the testing for us finally to be getting the figures. But we've got it now. We are collaborating with the government. We will cooperate with this. We will want to make this work.
Okay, thank you very much indeed for joining us once again, Sir Peter Soulsby. I'm hoping, with all due respect, we don't have to speak to you again because this is successful and we're not facing an extension of that lockdown. So I wish you and the good people of Leicester the very best of luck getting through that.